I'd like to introduce our next speaker, Dr. Vivek Roy. He is a professor in medicine, the director of bone marrow transplant, and a consultant hematologist here at Mayo Clinic. He has extensive clinical and research experience specializing in hematologic malignancies and stem cell transplant. And he's going to come up here and give us a really good talk on bone marrow transplant and associated complications. So if you will, please welcome Dr. Roy.
Well, thank you. It's nice to see a lot. So please ask questions, otherwise I'll be forced to show you my Machu Picchu pictures. All right, so what are the common indications for transplant? And before we talk about it, I'm sure you're all aware there are two main types of transplant. The autologous transplant, where we use the patient's own stem cells, and allogeneic transplant, where we use stem cells from the donor. There are obviously pros and cons of that, and depending on the specific situation, we might choose one or the other type of transplant. And these are the diseases that we commonly are treated by transplant. And within that group, the ones that are highlighted and underlined are typically treated by allogeneic transplant, and the others are typically treated by autologous. It is certainly not exclusive. A myeloma, for example, can sometimes be treated with allogeneic transplant, and the other way around. Leukemia, very special circumstances, we might utilize an autologous transplant for leukemia. And also want to emphasize that not everybody with these diseases needs a transplant. So we have to evaluate the disease quite carefully and do what we call risk stratification. In other words, try to figure out how bad the disease is likely to behave. Is it likely to be very aggressive or less aggressive? And the idea is that transplant itself has a lot of risks. So we want to make sure we utilize the transplant only if the disease is quote unquote bad enough to warrant exposing the patient to the risk of transplant. Does that make sense? So these are the common indications. And here, I have shown the data from an international transplant